I'm Yuran Berisha, founder of Unpain Clinic. I want to tell you about our Shockwave technology and what it is and how it works and the protocol of it. So typically when you hear about shockwave therapy in North America or in Canada, most of the places when they talk about shockwave, they're using this guy. It sounds like a jackhammer. This is great. It's an amazing tool. It's very good for superficial conditions. So anything that is about 2 inches deep, this works great. The best way to understand is that this is equivalent to about 10 massages in one session when it comes to relax the muscles. But we cannot call it shockwave. So at Unpain Clinic, whenever we say true shockwave, we're using this guy. So true shockwave uses the same technology as they break up kidney stones with. Imagine that. It can break down a kidney stone, but it does not hurt the kidney. So what this does, it actually reaches 5 inches deep effectively without hurting even a single cell. So with that reach, we have the ability to break down scar tissues and adhesions to release everything that is actually interrupting the healing. As the sound travels through the tissues, pretty much from the skin, and it hits the bone, it does not damage the bone. You will feel it when it hits the bone, but it feels like a deep pressure. At that time, your nervous system, your brain is going to think that something invaded the body down to that point, and it's going to mobilize the cells that are responsible to protect the body. So we are actually stimulating inflammation. Hang on. Most of the people, or everybody, tries to bring the inflammation down. Inflammation is a good thing. Without inflammation, there's no regeneration. Inflammation becomes a problem when it's chronic, when you're stuck in inflammatory mode. But not when the body responds properly to the injury. And usually the proper or healthy inflammation lasts about 72 hours. And therefore, scientifically proven, they were able to learn and prove that shockwave modulate inflammation. So it opens up the channels that are restricting the blood flow, they're restricting the healing, but at the same time, it's triggering your body to respond to healing. The main effect of the true shockwave is that it actually stimulates new blood vessel growth. So it triggers your body to create completely new blood vessels in that region where we apply the shockwave. So in about 4 to 6 weeks time, from the first session, you will actually get 200 to 300% more blood circulation and new capillaries on the injured tissue in that region where we do the shockwave. And in about 8 to 9 weeks later, it triggers the highest amount of stem cell migration. So it triggers your own stem cells without injections, without transporting them. It triggers your body to bring the stem cells and to repair the damaged tissue. So even though we initially aim for about 3 to 5 sessions on the region that we're trying to regenerate, and then we let the body heal, no treatment done, for the next 3 months you're going to actually have constant healing at 100% capacity going from the initial shockwave treatment. So how does the treatment looks like? So you come in on the first session, we do full assessment, we try to figure out where the problem is coming from. Because even though we use those amazing tools, if we don't actually figure out the cause, where it's coming from, it doesn't matter what you use. As soon as we do symptomatic treatment, the pain always is going to be there. So on the initial treatment, we do full body assessment, and then we do the treatment. So that takes usually about 45 minutes to an hour. Any session after that, we book it as half an hour to 45 minutes. Depends on the case that you have. So we aim for once a week to once every 2 weeks a session. You can still combine it with anything else. After the first treatment, you might be a little bit more sore, or it might go straight in relief. We are not worried if you feel a little bit more sore. Sorry about that I said, but hang on here. We are truly worried about that, but it's very healthy and normal if you actually get sore after the treatment, because we know we initiated the body response. But what happens most of the time, most of the clients, they feel significantly better, the pain goes down, and then they try to do more. That's where we worry actually a little bit more, because if you don't have the pain, and if you have that spirit of, doing more, or you have been waiting for that moment, as soon as the pain goes down, you're going to try to do more. So as long as we see either improvement or worsening of the symptoms, we are on the right path. And since we have this much Shockwave technology, we can customize the protocol based on your need. So even during the treatment phase, during the sessions, we can actually customize the protocol to be comfortable for you. You're gonna feel it. It's gonna be unique sensation, and we like to keep the pain around 3 to 4 out of 10. I forgot to mention about Flushwave here. Sorry about that. So Flushwave, it's actually a true shockwave system, and what this does, this stimulates more muscle growth. So it is a shockwave technology. It does everything what the focal does in terms of regeneration. But then if you have a muscle that it's not actually working properly, it's atrophied, it's so weak, when we use the Flushwave, it actually triggers muscle stem cells. So it stimulates muscle growth, and therefore we use it a lot for that reason, for muscle activation. We use it a lot for actual graceful aging, to stimulate facial muscle activation, and that's how it creates naturally facelift. And then we use it a lot for men's health, for vasculogenic ED. So if there is erectile dysfunction due to poor blood circulation, then this type of shockwave is very helpful. We do direct billing for our physiotherapist and chiropractor. So it goes under physio or chiro. And that's pretty much it. So we are looking forward to actually seeing you and start the treatment with you. So thank you for your time. Have a great day.